Hi guys, in this class we'll continue the topic diabetes mellitus. Uh, in last class I told you about how this disorder is produced, causes of these disorders. It's mainly due to the its deficiency, absence, and ineffectiveness of the insulin. Okay. Uh, in this I am telling to it is last class. Okay, here we have ended. In the moderate and severe cases of long duration, it is associated with permanent and irreversible functional and structural changes in the vascular system of the body, affecting organs such as heart, brain, kidneys, and eyes, and even the nervous system. Okay, this is the main point I want to tell you about the vascular system. I think most of you know about vascular system. It is mainly about the veins and arteries, okay, which take the blood and in which the blood flows. Okay, next thing, prevalence of diabetes mellitus. As we know, diabetes is increasing in developing country. It is attributed to great extent Asian. These are everything here. Evidence from epidemiologic studies clearly points that Indians as an ethnic group have very high risk of developing diabetes, particularly type 2. I'll tell you about what is type 1 diabetes, what are other types of diabetes mellitus. We'll learn about them. Okay, now it is mainly due to, here it's telling, increasing urbanization, affluence, changes in lifestyle together in increased life expectancy, increased prevalence of diabetes. Here it's showing India projected numbers being 35 million people. See, these are the projected numbers. Okay, source is from LIMET-P, 14th International Diabetes Federation. Okay, here it's showing the Indians are 31.7 million. Diabetes is called as Madhumeham. As we all know, we'll call as Madhumeham. For many of those who don't know, we commonly nowadays called as sugar, but in local language it is called Madhumeham. Even in Telugu it is called Madhumeham only. It is referred in India disorder in which there is excess sugar in the blood. Okay, excess sugar in the blood and the urine. Normally, insulin utilizes the sugar from the blood for energy production. So that's how it regulates the high sugar in the blood. But when the diabetic strikes, it could be due to two problems. First thing is, as I said, pancreas cannot produce sufficient amount of insulin to remove the sugar from the blood. As I told you, it's deficiency or insufficient, means it will only produce small amount of the insulin. And second one is, insulin is produced in full amount. Okay, how much it should be produced, that much insulin will be produced, but insulin cannot be effective, that is, it is ineffective, and it cannot help the blood sugar, or it cannot help it cannot help cells to intake the sugar levels. Here it's saying is the inadequate utilization of blood sugar. So what will happen if insulin is not there, or insulin is produced very small amounts, or even though insulin is produced fully, it can't make cell to absorb or intake the sugar levels. What will happen? Sugar will be continued, or sugar level in the blood will not be decreased. Okay, so Here it's saying there is a rise in blood sugar levels. If the blood rises above the 100 mg per 100 ml of blood, what will happen? That sugar will be excreted through urine. Diabetes cannot be cured, but changes in lifestyle, diet, and drugs can make individual lead to normal life. Remember, in diabetes, the blood and urine sugar levels are high due to inadequate production or lack of ineffective insulin. Diabetes can lead to a normal life if lifestyle and dietary changes are made. Lifestyle and dietary changes are must and should. See, now I am telling you about classification and etiology of diabetes. How many types of diabetes is there and what are the causes, its etiology and its symptoms, everything we will discuss now. Okay, first form of diabetes, type 1 diabetes. It is insulin dependent diabetes mellitus. Type 2 means non insulin dependent diabetes mellitus. As I already previously told you, type 2 diabetes mellitus is most common form of diabetes mellitus in Indians. Okay, it is a form of non insulin dependent diabetes mellitus. First one is insulin dependent diabetes mellitus. Second one is non-insulin dependent diabetes mellitus. Third one is malnutrition related diabetes mellitus. Third one is most uncommon, but it's not completely erased. It's just that it is uncommon. That is, it will be there, but it's not much more frequency, or it is not seen in many of the people as compared to type 2 diabetes or type 3 diabetes. That's why we tend to ignore the type 3 diabetes mellitus also. Next one is impaired glucose tolerance. Last but not least, gestational diabetes. As we all know, gestational diabetes is the new type of diabetes which is experienced by the pregnancy women. It is also nowadays most common type of diabetes. Okay, first one, insulin dependent diabetes mellitus. Mostly children and adolescents suffer this type of diabetes. It's mainly due to, it may appear in elders also, but it's just that, see, little or no production of insulin by beta cells of pancreas. That's why children and adolescents are suffered. It's not about their lifestyle or nothing, because they don't have a particular lifestyle as adults. Children or adolescents are most suffered because there is no production of little production of diabetes mellitus. Hence, young individuals, what will happen? There is no production of insulin, so we will give insulin from outside, okay, through injections. If daily injection is not taken, it could be life threatening metabolic complications. See, if there is children or adolescents, we tend to be more and more what in children and adolescents, we mostly tend to be more careful about the diabetes, whether in where if an adult or a 35 to 50 years patients or old people get this diabetes, we tend to ignore that. It's mainly due to, most of the times it mainly due to non-insulin dependent diabetes. It is also much more serious in just like insulin dependent diabetes, but we tend to ignore because in children there will be, we all know there will be no insulin at all. So what will we give? We give the insulin injections, but non-insulin dependent diabetes, it's not about injections. Okay, we'll learn when I tell you about non-insulin dependent diabetes. Uh, it could be life threatening metabolic complications, and the symptoms could be very severe. We know various types of insulin for short term or long term. Here we will do what these patients are given is carbohydrate, less carbohydrate, or carbohydrate content of the diet is adjusted. See, more people are underweight in this type of diabetes. You know what will happen? I already told you, carbohydrate, protein, and fat. These three are body required major energy givers. Our body is made up of these three. What will happen if carbohydrates are unavailable or cells are unable to pick up the carbohydrates? Next thing, fat is metabolized and protein also metabolized. So what will happen if there is no little fat or little protein content? What will happen? It ultimately lead to underweight of the patient, because protein is called as bodybuilders of the proteins are called as bodybuilders. It gives us muscles and everything. If there is low carbohydrates, so what will happen? The energy is compensated by fat and protein metabolism. Now type 2 diabetes mellitus, that is non-insulin dependent diabetes mellitus. As I told you, mostly it occurs in adults, that too overweight and obese adults. Normally it occurs even normal weight adults also. It's just that insulin is produced normally or even high. I already told you, inability or ineffectiveness of the insulin also result in diabetes mellitus. That one result in non-insulin dependent diabetes. Okay, insulin is produced, but problem is insulin resistance. As you all know, we are learning about antimicrobial resistance. That is, antibiotics are mainly not virus, it's bacteria are resistant to the particular type of drug, are getting resistance to that, because that is those variants are called antimicrobial drug resistant, AMR, particularly called as AMR. We are learning now all these things. It's just the drug is taken, but it's no longer effective to kill the bacteria or used to treat that, because in bacteria the genome we tend to get resistance